Assalamualaikum warahmatullahi taala wabarakatuh. My name is Nurul binti Ahmad Tajuddin. I was placed at Klinik Kesihatan Chukai, supervised by PSP Cik Umi Kalsum. Okay, today I would like to present two case studies. So let's move on to the first one. Okay, so the first case presentation is underweight infant. So this is table of contents for today's presentation. We move on to the introduction. For introduction, I explain on the socio-demographic or social history. So the name of patient is MZ. The age of patient is 9 months. Date of birth 5 November 2014. Date being referred 5 August 2015. So the gender of the patient is boy. Birth weight 2 kg. Birth height 43 cm. And the born status is premature. Father's occupation is teacher, while for mother occupation is housewife. So father education level and also mother education level are same, bachelor. So MZ have two siblings. The total number of family is 4, and the income of the family per month is 5,000 ringgit Malaysia. So we move on to the chapter 2, medical diagnosis. Okay, as you know, actually MZ was diagnosed as a severe underweight and severe stunted with normal BMI for age. So what is meant by underweight? Underweight is a weight for age that is -2 standard deviation below the WHO child growth standard median, while for stunting, the height of -2 standard deviation below the WHO child growth standard median for age. As you can see from the picture, you can compare the normal, wasted and stunted and wasted and stunted. So the wasted and stunted is for MZ. Okay. So poverty, parental illiteracy, insufficient feeding practices and large family size are all risk factors for malnutrition. So children who have had development retardation or stunting as a result of inadequate diet or frequent illness are more likely to be unwell and die. So long-term dietary deprivation causing stunting can lead to the delay the brain development, poor school performance and intellectual capacity. So next we move on to the chapter 3, diet diagnosis relation. So we have the first slide for diet diagnosis relation. We have food should be encouraged for infant. We should encourage them to eat more fruits and vegetables such as banana, cooked spinach, as this have a soft texture. Also, we need to give whole grain such as baby crackers and then meats, soft small pieces of beef or meats, okay, into their porridge. And last, dairy products such as yogurt and cheese. So next, food and drink that should be limit for the infant, which food that high in sugars such as candies and ice cream, as it can cause dental caries. Food high in salt such as some canned food, processed meats, and frozen dinner. Juice also cannot be consumed by babies under 12 months. Cow milk also cannot be given too much as it can cause hunger and causes poor iron absorption. So next, we move on to the nutritional assessment and intervention. For the first one, nutritional assessment, we have anthropometry, which is the current weight of the MZ is 6.4 kg, while for the current height is 64 centimeter. So I have using the formula for character age as he was born premature and low birth weight. So actually the correct age is 7 months 25 days. This is based on the WHO growth chart. So his weight should be 8.4 kg, while his height should be 68 cm. So this is the example of WHO weight for age for boys. I have plotted what the actual weight of MZ, and this is for the actual height for MZ. And this is for BMI for MZ, but actually the BMI of this patient was normal, so I'm not specific about BMI. Next, this is the 24-hour diet recall given by the parents, okay, through the nutritional consultation. So mostly, as most of the time, MZ eat thick porridge, okay, having a baby biscuit, and only have breast milk about 5 times per day. Okay, so the calorie intake is 756 kcal per day. Okay, so the comment is, as you can see, from the data given, we can see that MZ have low macronutrient intake, and also micronutrient intake, such as we cannot see either he is taken fruits as a snacking time. Okay, so parents claim that MZ as an active child, having scabies and diapers rashes in his diet, and have large family members and satisfied hygiene, water sources, and food access was available. So next, nutritional diagnosis and intervention. We have diagnosis inadequate of calorie intake related to low intake of macronutrients such as carbohydrate, protein, and fat, as evident by his weight and height. Okay, so the objective is to increase the weight and height equivalent to his age. Okay, principle, we providing some food that high in calories, add some oil or fat into the diet, and also increase the frequency of breastfeeding. So this is the calorie need for an infant, age 9 months. Okay, the total energy intake that should MZ take is for 840 kcal per day. So the below one is the macronutrient distribution. So I given about 55% carbo, 15% protein, and 30% of fats. Okay, this is the sample of menu planning for day 1, for weekdays, day 1 and day 2, and for weekend, day 3. So next, nutritional monitoring and evaluation. So patient should be monitored for the next 3 months by assigning another appointment to see the progress. But actually, I didn't have any data given for follow-up. So now we move on to the chapter 6 discussion. Why the patient underweight? Okay, the main concern is inadequate amount of macronutrient and calorie intake. So most of the reason why he become underweight because he was born as premature infant. Premature infant were born with low birth weight. Low birth weight was defined by WHO as weight at birth of below than 2.5 kg. So low birth weight can cause several impacts such as intrauterine growth restriction and preterm. So suggestion, we can offer greater variety, choosing the higher calorie, more nutrient-dense foods, attempting to make mealtime and enticing, pleasurable experience are all awake promoting possibilities. Needed to increase the frequency of breastfeeding per day, can also combine with a suitable formula mix. Usually, Klinik will suggest or give suitable formula mix such as full cream milk. Okay, can add on oil on his porridge because it can become an initiative to increase the infant weight. Increase the micronutrient intake such as zinc and iron, vitamin A and calcium, as this is very important for the proper growth of the children. So for conclusion, underweight among infant and children was common and needed to be intervened as to reduce the morbidity and mortality rate. In order to have a good nutritional habit, an infant should be referred to the specialist, dietitian or nutritionist first. We also need to keep monitoring their weight and height. Always follow the appointment dates in order to keep tracks on the progress. Okay, so this is the appendix, the menu template nutrient analysis. I'm using NutriPro analysis. Okay, so next, I would like to present on the pregnant woman with anemia, the second case study. So this is the table of content for the presentation. So we move on to the chapter 1 introduction. The socio-demographic or social history. Name of the patient is Puan Aida, working as a pembantu tabir GP21, age 27 years old, having a previous history on anemia for her first pregnancy. She was pregnant 70 weeks, which is in the second trimester. She late booking, and the distance from her second pregnancy with her first birth was not so far. So medical diagnosis, okay, she was being diagnosed with anemia while pregnant, with which her hemoglobin level was 10.2 gram per deciliter. So WHO has defined anemia in pregnancy as the hemoglobin concentration of less than 11 gram per deciliter. Anemia occurs when the amount of red blood cell is insufficient to meet the body physiologic requirement. As you can see from the picture, anemic amount of red blood cell are low compared to the normal amount of red blood cell. Anemia during pregnancy reported to have negative maternal and child health effect and increase the risk of maternal and perinatal mortality. The negative health effects for the mother include fatigue, poor work capacity, impaired immune function, increase the risk of cardiac disease and mortality. So we will move on to the third chapter, diet diagnosis relation. So first, what should be food should be consumed by the pregnant woman? Okay, they need to eat food that high in iron such as cockle, red meat, chicken, fish and bean, while they also need to eat food that high in vitamin C as it can help for iron absorption, so such as orange, green vegetables. Okay, eat food that contain folic acid also such as dried bean, green leafy vegetable and orange juice. Other than that, they also need to consume supplement of multivitamin that contain extra folate as being advised by nutritionist or dietitian first. Okay. So food should be avoid milk, tea and coffee, gluten, legumes and whole grain nuts and brown because this type of food can cause or can interrupt, okay, can reduce the iron absorption in the body. So next medication, we have hematinic is a substance that is essential for a proper formation of components of blood. Example of hematinic is folic acid, vitamin and iron. So for pregnant women, daily oral iron and folic acid supplementation with 30 mg to 60 mg elemental iron, 400 gram folic acid is suggested to prevent maternal anemia, low birth weight and preterm delivery. If a pregnant woman is diagnosed with anemia, her daily elemental iron intake should be raised to 120 mg until her hemoglobin concentration return to normal, which is about 11 gram per deciliter. Okay. In setting where anemia in pregnant women is a severe public health problem, where at least 40% of pregnant women have blood hemoglobin below than 11 gram per deciliter. So a daily dose of 60 mg of elemental iron is preferred over a lower dose. This is based on the WHO 2010. Okay, so next we move on to the chapter 5, nutritional assessment and intervention. So, okay, for assessment, here we have anthropometry. The current weight of Puan Aida is 50 kg. For the current height is 155 centimeter. So the booking weight is 45 kg. So the BMI of Puan Aida is 20.8 kg per meter square. Ideal body weight 54 kg. Actual body weight 52.4 kg. And for the ideal weight range is 43 to 60 kg. So next, biochemical. So Puan Aida hemoglobin level is 10.2 gram per deciliter, which she was diagnosed as a mild anemia, which is in a category 1. Okay, so we have this category which is moderate, like 7 to 9.9. For category severe, below than 7 gram per deciliter. So above 11, considered as a normal. So for dietary intake, this is the 24-hour diet recall of Puan Aida. Okay, most of the time from the table, we can see that she was not having enough iron actually. See, the calorie intake is 1,636 kcal per day. So based on her dietary recall, okay, so based on her dietary recall, we can see that Puan Aida calorie intake was 1,636 kcal per day, which is actually low for the pregnant woman. Okay, and from mostly she was having a high fat food diet, and also she taking food that lacking of iron rich food sources. Okay, so for nutritional diagnosis and intervention, for diagnosis inadequate mineral intake related to the low intake of iron-rich food and poor iron absorption in body during pregnancy as evident by low level of hemoglobin. And for objective to increase the iron level as increased to normal range. Principle, provide iron-rich food, provide food that contain folic acid, provide correct way to consume medication. So we're using estimated energy requirement by Harris-Benedict equation. So we get after multiply by activity factor, I get about 1,552 kcal per day. So I add with 280 kcal per day for the pregnancy for second trimester. So I get about 1,832 kcal. And when using quick method, I also get about 1,827 kcal. So I give about 1,830 kcal. Actually, 1,850 kcal also can. So for the macronutrient distribution, so for the micronutrient distribution, I divide carbohydrate by 60%, protein 15%, fat 25%. So I got 12 exchange for carbo, 4 exchange for protein, and 5 exchange for fat. Okay, so this is the exchange table. As you can see, I giving low fat milk 2 exchange, cereal and starch 12 exchange, fruits 3 exchange per day, simple sugar 2. Okay, so fish and shellfish 2, meat and meat product 2, fat about 5 serving. Okay, so for the menu planning, this is for weekday, we have day 1 and day 2. And for weekend, this is the example of menu planning. So for monitoring and evaluation, patients should be monitored for the next 3 months by assigning another appointment to see the progress. But unfortunately, I was not given any data for follow-up, which for evaluation. So for discussion, okay, she was having low food sources that high in iron intake. So consume high intake of fats, which can cause rapid weight gain and can affect her pregnancy. The main concern is inadequate iron intake due to the low intake of iron-rich food. Actually, pregnant women required about 27 milligram of iron per day. Okay, so iron requirement rise about twice and two thrice during pregnancy, not only for hemoglobin synthesis but also for the fetus and creation of specific enzyme. Consume food that high in vitamin C also can help in improving the iron absorption. It absorbs non-heme iron and store it as a form that can easier for your body to be absorbed. Okay, we have two types of iron, which is heme iron and non-heme iron. Heme iron easily and quickly being digested by the body, mostly from meat, fish, and other sources of animal protein. Non-heme iron can be getting from the beans, vegetable, fruits, and nuts. So food that can hinder from the iron absorption are food that contain phytate, calcium, and polyphenol. So for conclusion, every prenatal appointment should include nutrition education about eating throughout the pregnancy. These include advising on eating a diet high in iron and food that improve the iron absorption, and avoid item or food that can hinder iron absorption. Supplemental iron can be ceased at the time of delivery unless anemia persists throughout or after pregnancy, or if the patient is at high risk of iron deficiency anemia, okay, which can cause excessive blood loss during pregnancy and multiple births. So this should be referred to the dietitian and nutritionist or specialist first before being consumed. Okay, so this is the appendix, the menu template nutrient analysis by NutriPro, and this is all the reference. So that's all from me. Thank you.